here doing an Agnes procedure, and Agnes is microneedling with radio frequency. So we can get rid of fat because it will melt your fat. So we do a lot of eye bags, a lot of jowls, cementum. If you have lipomas, those little fat collections on your arms or legs or wherever, we can really get rid of them with Agnes, and it does not, that fat does not come back. So I've already done one pass, but I'm going to show you the jowls here. I'm going to have you turn away from me a little bit. And so I'm just going to pinch and insert. And what I did was I numbed my patient's skin with some lidocaine, injectable lidocaine with epinephrine. So that's why her skin is a little blanched in places. But you can hear the sizzle. That was a good one. It's fat dying. I love Agnes. It's also good if you have had liposuction and you might have an area that still has a little tiny bit of fat, or it's uneven, or you have a little pocket where the fat didn't get taken care of. You can do Agnes on that area. You can also treat sebaceous glands. So Agnes was originally made for acne, to kill the sebaceous glands. And that's why it's from South Korea. Dr. An developed it, and he called it Agnes because it sounds like acne. Awesome. So that is the entire side for the jowl. Now the next thing I'm going to do is I'm going to tack her skin up. So we're going to pause for a second while I change my needles out. I'm going to tack her skin up. So I'm using a little different needle. I'm just going to pull. Still going to get some sizzle. But the point of this one is to help pull the skin. You're doing okay? Mm-hmm. Okay, and we're going to do this entire area. And just kind of pull it and pull it again. Pull it, put it inside and pull it again. Put it, and this needle's going on a little bit of an angle. There's many needles to choose from in this, in using Agnes. And so they all work a tiny bit differently. They're different lengths. And you just have to choose the appropriate one for what you're doing. And so afterwards, she probably is going to have some bruising. We typically have our patients come in and do a light wave every other day, which is LED, to help them heal faster. We also use exosomes, which they're like little messengers that tell your body to heal faster, and it cuts down the inflammation and swelling. Those are amazing. We also put on hydrocolloid dressings right after, so that way it can help the healing process as well. So there's lots of things you could do to help heal quicker. So LED, hydrocolloid, and exosomes. This is definitely not something that you do right before you're going to go to an event, because you probably will be bruised. We will combine this with something called Scarlet, which is Agnes's sister, because it's more radio frequency with microneedling that helps tighten and lift. So once you get rid of the fat, you want to tighten and lift. This is also tightening and lifting, this technique. But when you combine it with Scarlet actually helps to coagulate. So when we always combine them, because it helps the Agnes not bruise as much, because you're adding more energy that is a coagulation type of energy. And plus now our patient will be also numb here because of the injections, so the Scarlet is more comfortable. You doing okay? Mm-hmm. Okay. We will typically do 2 Agneses, so usually it's one now and one in somewhere between 4 to 6 months, and then 6 Scarlets is typically what's recommended. And again, doing the Agnes with the first Scarlet, and then doing Scarlets once a month, and doing the second Agnes with the 5th or 6th Scarlet is a perfect regimen. And Scarlet will help tighten and lift, like I said. So, and because it's not a laser and it's micro needling with radio frequency, we can use Scarlet all the way to the lash line. So if you have laxity of your eyelid, Scarlet can help tighten. So maybe you don't need that blepharoplasty, or maybe you'll delay that blepharoplasty if your eyelids are heavy. So it's a great alternative to getting surgery. You can definitely combine this treatment with other treatments. So sometimes what people will do is they'll do an Agnes Scarlet combo for a while, and then after that they'll do BBL, or they'll do Halo or Moxie. They'll do laser treatments to help treat pigmentation, redness, brown spots. And those treatments will also help stimulate collagen and help you look younger and be younger. All of these different treatments that we offer all work together, and they're not mutually exclusive, just the timing might be. So we wouldn't do this and right after this do a Halo immediately after, because your skin has already been injured by the Agnes and Scarlet. But you could do the Halo in 2 months, and then treat the pigmentation. Lots of ways to approach your skin and making it younger and helping with the pores and texture and all of that. And I like to equate it to going to the gym. If you go to the gym today and you do weights today, and tomorrow you swim, and the next day you run, all of that is going to make you have a better body. So if today you do Agnes and Scarlet, and in another month you do BBL or Halo, and in another month you do Moxie, all of those things, nothing is wrong. You're just approaching your skin in different ways, and they all work well together. Pre-treatment, there's really no pre-treatment for this. So, and also, you don't need to be not tan for this. So a lot of light and laser treatments, you can't have a tan. It doesn't matter for microneedling or radiofrequency. You could be tan and do this procedure. You can be going to Hawaii and do this procedure. I don't really recommend it, but you don't have to stay out of the sun when you do these. One big post-cure thing, though, I do recommend is that if we're going to do thousands of channels in your skin, don't sleep with your pets. Don't decide you're going to go swim in a lake. Try to keep your skin clean. So always recommend changing your pillowcase when you go home that night. So a lot of people own radiofrequency devices, but unless you're getting the radiofrequency to the tissue, to the goal, which is get it down deep so it can do its thing, it really doesn't work that great just on the surface. So that's why microneedling, when it started being combined with radiofrequency, has made such a big difference in tightening and lifting, because now we're getting that radiofrequency super deep. So the radiofrequency irritates the fibroblasts to make new collagen, and the microneedling pokes at the fibroblasts and they make new collagen. So both of these modalities in the same little needle will make you make collagen, which is what the name of this whole game is about. How do I make the most collagen?